Hi, welcome back. You're listening to Dr. Margaret Ames and Your Dental Health. The mission of the show is to get the word out about biomimetic dentistry. It's a new paradigm shift in dental care. It's really important. The first half of the show, we talked about root canal therapy. Root canal therapy gets rid of the infection inside your tooth. Now, some people have those areas on the x-ray that I can see, and I show them like this, I know this tooth is dead. You need to get a root canal. And they'll say, well, I can't feel anything. Well, there's two aspects to that. One idea of I can't feel anything is that if there is a lesion at the tip of your root, it's called the apex. If there's a lesion there, people say, oh, just leave it alone. I don't feel anything. That's not so good. I tell people, you know what? Your immune system has strength. So let's say your immune system has 100% of its strength. If you're spending 50% of your immune system energy trying to hold off that infection from spreading to the rest of your body, then you only have 50% left to deal with the common cold, to deal with germs that you have on door handles. You need your immune system. God forbid something happened that you were exposed to the flu. I mean, you want to have all your immune system ready. And I tell this more as people get older. You need to have your immune system ready and available and be as strong as it can be. So if you do have this quiet little lesion on the x-ray, then it's important to you to have the root canal and to get it cleaned out and filled, and then restored. The other thing that came to mind just now about I don't feel anything is several times during the course of the day, I'll be doing the examination after the hygienist finishes up with her exam. And actually, they're not legally allowed to examine, but they do a scan of the mouth while they're doing the cleaning. I do an oral cancer exam. I check for mobility, I check for gum disease, and I check for decay. And if there is an area of decay, some people will say, you know what, I don't feel anything. Do I have to get it done? Well, let me tell you, you have to get it done. Because if you wait until you feel something, the nerve is inflamed. Inflammatory cells get inside the tooth, and you can never get them out. So you want to get to them, you want to get and take out the decay before the inflammatory cells come in. Your bloodstream brings them with it, and they stay in there. So you don't want inflammation. So the important thing is to catch things early so that it becomes an easy process. So if you do need a root canal and you haven't caught it early, or your crown has failed, because crowns do fail, insurance companies are willing to pay for another crown after 5 years. They always ask if it's a replacement crown, because there are a lot of replacement crowns. And they say, if this is a replacement, when was it first placed? So we look up the date and we tell them. If it's over 5 years, they pay what they normally would pay. Of course, it depends upon what your employer has negotiated with the insurance company. Now, that's another issue. Let me tell you about understanding dental insurance. Dental insurance is not truly insurance. Insurance is defined as a lot of people pooling their money so that if one person has a catastrophe, then other people's money will help them get back on their feet. That's like homeowners insurance. If you have homeowners insurance and your house burns down, you're going to get probably full replacement or whatever, however your policy reads. But if everybody's house burned down that held that policy, your insurance premium would be whatever it would be, $400,000 a year or $1 million a year, depending upon what your house costs. So dental insurance, you can't protect people against or have insurance for something that happens to everybody. I know one or two people that have not had a dental problem. It's rare. It's really rare. But even gingivitis, that affects your heart. The C-reactive protein, there's some inflammatory cells that it's been proven now that if you have gingivitis, you'll have those inflammatory cells in your bloodstream, and they can affect the laying down of the cholesterol, the plaque on your arteries. So you don't want that. So it's important that you know how dental insurance works, because what it turns out to be is inserting a middleman between you and your dentist so that somebody else can make some money off your sad situation. Originally, medical insurance was also designed this way. Payment for routine office visits and basic medications and low deductibles are a relatively recent modification in medical policies. just to give you additional employee benefits that are not true insurance, but they're tax-free benefits. Now, we have a star performer in our office. Actually, we have all my staff are star performers. Marion is at the front desk, and she really knows how to go to bat for you. Actually, recently, she went to bat for a patient who was denied, and she stayed on the phone. She stayed on hold for that patient because she knew that the insurance company wasn't doing the right thing by her. So she did that. The patient was so happy that she got her either flowers or a gift certificate to a restaurant. I mean, we really go out of our way to help you. So let's get back to biomimetic dentistry, because we want to avoid those root canals. You want to come in, I'll examine you, explain everything. Actually, after the examination, where you get to know me and I get to know you, and we build a trust in each other, I like to have what I call a review of my findings. We go over everything together so that you can make the decision on what you want to do. It's your mouth. I want you to have a lifetime plan so that you don't all of a sudden on vacation have something go downhill. If you're on a plane, you have one of those quiet lesions that shows that you need a root canal and you have a change in cabin pressure, you could have pain from that. Scuba divers, you could have pain from that area inside your tooth. So biomimetic dentistry techniques continue to minimize the need for root canals and crowns and caps, as they're sometimes known. Biomimetic dentistry is minimally invasive, advanced adhesive technique. It's not just bonding. It's bonding in a way that uses the materials that are really advanced in a scientific way that's really advanced. You don't want to use the techniques and use the 20th century. You don't want to use these same materials and do 20th century techniques. You don't want to fill potholes. So biomimetic dentistry, only decayed and cracked tooth structure or weak enamel is replaced, and your healthy tooth structure remains and no longer needs to be removed. This is like one of the happiest parts of my day. When I'm there doing my biomimetic dentistry and knowing what is really making a difference for a patient, I know that they're not going to need the root canal. Now, I'm only 5 years out on this, but my mentor, Dr. David Alleman, who I had on the show a while back, he has taught me this, and when I met him, he was 10 years out. And anybody that had really, really deep decay, that in the past we would have had to say, you know what, you're going to need a root canal, you might as well get it now. That's a lot. That's a big investment. It's a good investment. But if we can avoid a root canal, keep the tooth vital, keep it feeling what it's supposed to feel, normal in your mouth. Have it be able to flex and bend, not capped or crowned, where the rigidity of the crown actually causes the crown to leak underneath. So I recently reviewed the original research and reports, and I'm more dedicated than ever to supporting this paradigm shift in dentistry. So to this end, I founded a group of leaders, the Academy of Biomedical Dentistry. I'm the founding president. It's a not-for-profit group fostering this technique, so I can find ways to get it out to the public. So an increasing number of patients are finding me on the website and traveling to Greenlawn to obtain this tooth-conserving dentistry. No tooth deserves a crown. The age of adhesive rebuilding is here and now in Huntington. The science is clear and succinct. Adhesive dentistry is analytically based and predictable. If 20th century dentistry had been so great, there'd be no such thing as redoing a crown. There'd be no such thing as an implant or a root canal therapy. This is my passion. I really want to help you to avoid the amputational root canal therapy and full crowns. You don't have to have such aggressive drilling. Minimally invasive dentistry is here. In many cases, you can have the decay removed by sandblasting it out without Novocaine. I'm passionate about this stuff. Call me. So where was I going to go to next? I wanted to take one of your questions because I do get a number of questions on my website. Thank you very much for listening and for being involved with this whole process. So let's see, where's one of my questions? When was amalgam invented? Why do we use this stuff? Oh, in a past show, one of my guests had mentioned that there's lead in fillings. I have to correct that because I don't want to spread false information. There's no lead in silver fillings. There never has been, but there is mercury. And there are indications that dental amalgam was first used in the Tang Dynasty in China, approximately in the 600s AD. So let's get current, folks. Let's get the metal out. Take care of your teeth before they become catastrophic failures. If you're, I really want you to have this done. I can't say anything else. Go to my website, drames.com, DRAMES at DRAMES.com. Thank you for listening. I look forward to your tuning in next week. Get the word out about biomimetic dentistry. Call my office at 631-261-4525. That's 631-261-4525. Continue to send me your questions. I want to be responsive to what you want to know. I want to help you to have less invasive, more comfortable, and beautiful dentistry. Thanks for tuning in, and we'll be around next week.